What's up, everybody? My name is Jessi Witherington. I'm a student at South College in the January 2021 cohort. I will be the student president for the AAOMPT Special Interest Group in 2020. So what I want to teach you today is unilateral posterior anterior mobilization of the cervical spine, and then also the prone first rib manipulation technique. Now, that being said, before we do any of these techniques, we would go through our alar ligament testing, our Sharps purser, and our transverse ligament to make sure that all those ligaments are intact. We'd also want to look at our Canadian C-spine rules to rule out a fracture, and we'd also want to look at our arteries to rule out any insufficiency. So we would use our 5 Ds and 3 Ns, and then for the internal carotid, looking for Horner syndrome. Now, go ahead and lay prone for me, Steve. Now, normally a UPA is used to help with pain and hypomobility at a given segment that we would find in our screen of the cervical spine. And this would be seen with the spring test. So if Steve had pain, let's say on C4, I'm gonna come in, I'm gonna bring up his musculature to give him a little extra cushion, make sure I'm in a good PT stance, find the spinous process, go just lateral onto the pillar. So now you're gonna make sure your elbows are in with your body and you're gonna sink into that pillar. You're not gonna just use your arms. We're not pumping on him like this. Bring the muscles up, spinous process, find the pillar. Look for R1, his is right there, come back out, find R2. Now, if we were addressing pain, we would do grades 1 and grade 2. If we were addressing hypomobility of this segment, we would use grades 3 and grades 4. Go ahead and sit up for me, Steve. Face that way. So now, for the first rib manipulation, if you have not had the MSK3 coursework yet, at the request of faculty, do not perform the thrust. So we would use this first rib manipulation when we find hypomobility in the first rib on either of the given side. We would find that using our cervical rotation lateral flexion test. In this demonstration, I'm going to be testing Steve's right rib. I'm going to take his head, turn him away from the side, make sure my hand is firmly on that first rib, and bend him down until I find that rib popping into my hand. We would test this bilaterally to see which side has a impairment. Now, say he does have an impairment on this side. What I'm gonna do, I'm gonna take this. Steve, go ahead and lay facing me with the side of your face on these towels. I'm gonna position his arm of his side facing me up on the corner of the table. I'm gonna have him droop this arm down by his side. Now, we use both hands in this technique. I'm gonna come onto his upper trap of the side that I found the impairment in. With my other hand, I'm gonna be imparting a side bend and rotation at the same time. Your hand is gonna go just anterior to his ear. Now, for the 3 pre-thrust setup, you're going to be taking your hand on his upper trap, and I want him to be as relaxed as possible. So Steve, I want you to be a bobblehead for me. What I'm looking for is when I wiggle him, I want that dissociation. Go ahead and reposition. So with what that does, it imparts extension, and then with your top hand at the same time, you're gonna be imparting a side bend. Now, Steve, go ahead and be a bobblehead for me. As I do that, I'm gonna roll him onto his nose and get my hand firmly on that first rib. This arm aims down towards T1 and T2. Now, I'm gonna take this top hand just anterior to his ear, impart a side bend and a rotation. We are looking for a firm, crisp end feel. This is Steve's end range. For the thrust, 60% of your force is coming through the bottom hand on the upper trap. 40% is coming from your top hand on his head. The thrust is just gonna be this. Small and quick with that firm end feel that you feel. This is how it's gonna look. Steve, go ahead and be a bobblehead for me. wiggle him onto his nose and myself onto his first rib. Impart the side bend force, find his end range. So after performing that manipulation, we would again have Steve sit up and we would perform that cervical rotation, lateral flexion again to see if we had produced any change in his mobility. I sincerely hope all of you have the most awesome day. Thank you for your time.